At your first prenatal visit during your pregnancy, your provider will order a number of routine prenatal labs. The term prenatal means prior to birth and refers to the time period of your pregnancy. It's helpful to know what you will be screened for and why. These tests will require a blood sample, urine sample, and vaginal swab sample. Some testing may have already been done before you are pregnant during a preconception appointment. Your provider will check your blood type and rhesus type, or Rh type, which is a specific protein on red blood cells that has implications for the health of your baby. Your provider will make sure you don't have antibodies to other types of blood that could potentially put your pregnancy at risk. Your provider will get a starting evaluation of your blood level and platelet level. This helps ensure that you're not anemic or have complications that could lead to dangerous bleeding during your pregnancy or at delivery. You will be tested to see if you are immune to German measles, also known as rubella, and if you are immune to chickenpox, also known as varicella. If you are not immune to either of these, it will be especially important to avoid infection during pregnancy, and you can get a vaccine after delivery to protect you in the future. All women in the U.S. are screened for HIV, syphilis, hepatitis B, chlamydia, and gonorrhea. Some providers add tuberculosis screening to this panel. Women with risk factors should also be screened for hepatitis C and Trichomonas vaginalis. For patients with other risk factors, Zika screening, toxoplasmosis screening, or herpes screening may also be offered. Your provider will check to see if you're carrying any bacteria in your urine. You may not have any symptoms, but if you have any bacteria, you will need antibiotic treatment to prevent a potential kidney infection during your pregnancy. The American College of Obstetrics and Gynecology recommends all women be tested to see if they are cystic fibrosis carriers or spinal muscular atrophy carriers. If you are found to be a carrier, your partner should also undergo testing. Women who are at risk of pre-existing diabetes will be tested at the beginning of pregnancy, and most women will then be tested for gestational diabetes between 24 and 28 weeks of gestation. Thyroid screening is not recommended for all patients. If you have any risk factors or a history of thyroid dysfunction, your provider will recommend screening. Your provider will offer you a non-invasive fetal genetic screening test to determine if your pregnancy is high or low risk for Down syndrome or other genetic trisomy anomalies. This testing is optional, and you have the choice to meet with a genetic counselor to find out more about it. If you test positive, you would then be given the option for invasive testing, such as with chorionic villi sampling or amniocentesis, to diagnose if your pregnancy is positive for a genetic anomaly. At 35 to 36 weeks gestation, your provider will collect a vaginal swab to test for Group B Streptococcus. This type of bacteria can infect your baby during delivery. If you are a carrier, you'll be giving antibiotics during your labor. As always, we encourage you to ask questions if you don't understand why a particular test is recommended by your provider. Your healthcare team is here for you, working to ensure your pregnancy is off to a healthy start.